Okay. Hi. Hello, everybody. A very good evening to all of you. Good evening. Good evening. So I believe I am audible and visible at your end. Everything is perfect. Video, audio, बता दो एक बार. Good evening. Good evening. YouTube में आप लोगों का नाम बहुत अजीब सा आता है सब. मेरे को पढ़ने में दिक्कत आ रही है. जिल लखे दी. Oh my God. Twilight something something. Anyway, so श्रद्धांशु दीप्तांशु शम. ओके, सो यूट्यूब में नाम बहुत अजीब रखते हो आप लोग. मेरा नाम भी थोड़ा सा अजीब है. मेरा यूट्यूब में फिजियोलॉजी दादा बोल के नाम पे है. सो दैट्स ओके. बट पढ़ने में दिक्कत हो रहा है. सो दैट्स आई एम नॉट रीडिंग ऑल दिस नेम, बट आई एम गेटिंग योर चैट. सो थैंक यू सो मच फॉर ऑल ऑफ यू फॉर ज्वाइनिंग. गुड इवनिंग. A very good evening to all of you. So we are going to start a session, which is the name of the session is PYQ challenge, and it's a 50-day challenge, all of you know. And today we are going to discuss the subject physiology. So if you look at the title, na, PYQ challenges, so some of you who have not heard this thing, I mean previously, you may be thinking that this is a session where we are going to discuss you the PYQ of all physiology and their possible answers. So basically it's not a question answer or PYQ and their answer session. Although I have kept some of the PYQ in this session to break the monotony. So you must be thinking ki, then what is the session is all about? Why you are taking a session of around 1 hour, wasting our time? Because you know ki NEET PG is in the month of August, and in the month of July you are taking a session on PYQ challenges where you are not going to discuss the PYQ, their answer, or you are not going to give some knowledges, rather than you are wasting our time. So what is this session all about? So some of you know that this session is intended for those who are solving the PYQ currently. So basically the target is that you should solve the physiology PYQ for the last 2 days, and then you should listen this session to understand that among all these PYQ for the last 5 year or 7 year or 3 or whatever you are targeting, among all those PYQ, what is the most important thing I should focus in physiology? What is the most important topics which I should concentrate in this physiology? What is the current trend in the PYQ in physiology? And what are the most important topic? What are the core concept which I must have to learn? And what may be the future trend? So in this session, basically, I'm going to do that. I'll show you that what is the trend of physiology PYQ before the year 2020 or 2021, and what is the current trend, means what is the trend of physiology PYQ for the last 5 years, and before 5 years I will also show you that what was the trend. Okay, and from there I'll also give you certain MCQs, that is basically PYQ only, just to break the monotony of the session. Because if I continue go on discussing this is the important topic, this is not, most of things you all know. So in between I'll put some of the MCQs for PYQ basically, and I'll give you the answer, and I'll tell you why I kept this PYQ there, because that is maybe some typical MCQ in physiology or maybe very atypical MCQ in physiology. That kind of MCQ I have kept, not all the flat MCQs I have kept here. And I'll also list all the important topics which has been asked in last 5 year PYQ, that I'll show you. So those are the topic you must have to revise before your exam at least twice. And in the last slide I have kept certain topics which may be asked in the upcoming exam. But again, I'm not the question setter, and I'm here not to leak the questions. Obviously I don't have access to that. So that is my personal guess. You can say personal intuition or something like that. It may click or may not, but depending on the experience, depending on the PYQ trend, certain topics I have listed which you should read apart from the core important topics of physiology. That is the basic motto of this session. Got it, everybody? I believe now we got it. What is the basic motto of this session? So Now let's start the session. So basically it will be a chit chat kind of things. You may put some chat in between. And I believe all of you know that what is the changes that happen this time in the NEET PG, like number of question has been reduced and you are going to get more lengthier question. All those things has been discussed by our faculties and any other platform. They are already discussing this. So that thing I'm not going to look into, right? Because already you know that thing. So I'm mainly concentrating on the physiology subject here. Okay, right. So the first thing they say, what is written here? NEET PYQ trend before 2021 means लास्ट 5 ईयर को छोड़ दो, लास्ट 5 ईयर को छोड़ के उसमें पुराना, उसका पुराना जो है, जो एमसीक्यूज है, if you look at those PYQ, so what is the trend? So if I show you here, so these are the thing like general physiology, CBS, RESP, renal physiology, GIT, neurophysiology and endorepro. So these are the neurophysiology and endorepro. So these are the things. In the x-axis and y-axis is the number of questions. And this is 2 years, that is NEET PG 2019 and 2020. So if you look at here, you can easily understand that the major chunk of questions has been asked from this respiratory physiology, major chunk of question, and the neurophysiology. Okay, so these are the two main targeted area where the question being asked in the physiology, but that is before 2021. So I'll also show you similar kind of graph what happened after 2021, means last 5 years. Okay, so whether the trend has changed or I have to shift my focus. Okay, but before that, so now we came to understand that I have to read very carefully in the respiratory and the neurophysiology. And obviously renal, CBS, it is also there, general physiology also there. But if I have to focus only, suppose I have very limited time to revise certain thing, so what I'm going to look at least these two topics I should not leave. Okay, but that is the 2021 before trend. So I will show you what is the current trend. And if you look at that, what was the code area where the MCQs were being asked before 2021, then I have listed certain topics. Although these topics are still valid today, means these are the topics which you have to concentrate for recent trend also, because I have checked what is the recent trend, what are the topics they're asking. So these are the most repeated concept, most repeated topics where the physiology questions are coming up. Like for example, in general physiology, you know, this RMP and action potential, these are the two topics which I say that these are the topics which are known as the evergreen topic. Okay, always the questions is going to come from this topic in physiology. Okay, without this topic, MCQ cannot be framed. Okay, one of the questions at least it will be coming from the RMP or action potential, right? So these two are the evergreen topic in physiology. You will see that in recent trend also these topics are also there. Okay, so in between I'll look at the chat. So good evening. Okay, just listen. And then in respiratory physiology, see high altitude physiology. Again, this is a topic which is also valid in current trend also, in the recent year also. VQ ratio, oxygen hemoglobin dissociation curve, and the respiratory center. In cardiovascular system, although we read much about the cardiovascular system, but if you look at before 2021, then the trend was only, the question was concentrated on the CVS reflexes, like for example, you know, Bajol-Jaris reflexes are there, Bain-Bich reflexes there, okay, Cushing reflexes are there. All those reflexes are the main topic in physiology, okay, in CBS and JBP. They are normal waves and the abnormalities of those waves. Those are the main concentrated question, right? Okay, अब ये रेशियो दिखाएंगे आपको. न्यूरोफिजियोलॉजी में इन muscle spindle, Golgi tendon organ, these are the very important topic. Along with that, nerve fiber classification, again an evergreen topic, you know. So this nerve fiber classification, jo A, B, C type of fiber is there, A fiber and B fiber, myelinated fiber, and where this A fiber, alpha is located, beta is located, and the anesthesia affect which fiber most commonly. So all this topic you know, but you have to understand that this is again a evergreen topic in physiology. You should always revise this table before going to exam. And rigidity means decerebrate, decorticate rigidity, and the sleep physiology. Sleep physiology is again a evergreen topic in physiology. Always the questions is coming in any of the year, okay? Maybe this year, maybe next year, maybe every year it is coming, okay? And in renal physiology, before 2021, trend was there, mainly the question was related to the filtration barrier, filtration related things, or the aquaporin channel. And in reproductive system, prolactin hormone, cortisol regulation was the main target area of the reproductive physiology. Okay, now I'll tell you what is the current trend, but before that I'll look at the chat. Please sir, please teach the respiratory center topic in detail. I keep forgetting every time. Okay, forgetting is as a very common thing. Okay, so I also forget because my brain is also aging, your brain is also aging has important important affect it affect your memory very much. Okay, so what you have to do, you have to revise. Okay, because respiratory center, basic thing you should not forget, there are different subdivision. That basic that detail you may not remember, but at least you have to remember the connection, which center is connected where. If I get time, I'll surely do that thing. Okay, right. So now, after this discussion of the historical trend, I should say, because this is the trend before 2021. Always we are interested in last 5 years. So this can be treated as an historical trend of physiology question. So these are the topics which are important historically, but it is also important today. I'll tell you later. But before that, looking into the recent trend, we are going to solve certain MCQs. That what are the type of MCQs before 2021. I'll give certain typical or atypical MCQs so that you will be understanding that what are the kind of questions they were asking before 2021. Right. Second, stimulation generation sodium channel is closed or open. Most of the sodium channels are closed. They cannot be open. Most of them has to be closed. Most of them has to be closed. Okay. Now this is a question I believe all of you can answer because you are solving PYQ. That is the main motto of this session. So quickly, I should say you all know this answer. हाँ, वही हम लोग बताएंगे नया ट्रेंड में क्या क्वेश्चन आ सकता है वो बताएंगे. मैंने क्लास में शुरू में बोला है कि व्हाट शुड बी द अपकमिंग टॉपिक दैट आई विल आल्सो डिस्कस, व्हाट आर द कोर टॉपिक इन द लास्ट 5 years दैट विल आल्सो डिस्कस. सो थोड़ा सा मेरे साथ बेयर करो, 1 घंटा का सेशन है. आई थिंक आई विल फिनिश बिफोर दैट ऑल्सो. सो बिफोर दैट आई बिलीव ऑल ऑफ यू कैन आंसर दिस क्वेश्चन. सो व्हाई द ए इज रॉन्ग? बिकॉज दिस इज नॉट द decorticate, this is the typical rigidity which is known as the decorticate rigidity. Decorticate rigidity, if you cut the brain above the midbrain level, then that kind of rigidity is known as the decorticate rigidity. So this is A is true for decorticate rigidity, not here. That's why whenever you are answering this question that which of the following is the false, that you should answer. But here additionally they are also asking that this upper limb flexion, so this flexion of the upper limb is done by which type of tract? You have to remember that this is due to activation of rubrospinal tract. Okay, so flexion of the upper limb in case of decorticate rigidity is due to rubrospinal tract, and for the decerebrate rigidity, what kind of tract? This is the pontine reticulospinal tract. Pontine reticulospinal tract. Okay, so these are the core thing that you should not miss at any point. Okay, someone is asking what kind of question can be asked nowadays. They will give similar kind of topic, similar kind of concept, but you can predict that the stem of the question will be a little lengthier. Okay, because you are getting more time for a same question. So obviously they are going to give you a lengthier type of question. A clinical type of scenario will be given that a patient has suffered from this kind of stroke in the brain, and in CT scan or in MRI, the lesion is found to be at this level, and the posture of the patient is this kind of this. What is the kind of track which is causing this kind of rigidity? So this kind of question will be given from the similar kind of topic. Getting my point? So they are going to make you the question in a more clinical oriented, where your mind should know that I am going to get a lengthier stem of the question. So don't get frightened, because everybody is going to get the same kind of question, everybody is going to get the same kind of problem, right? Because this time single session, so everybody in the same place. Don't take एडिशनल टेंशन दैट तो ये बहुत लंबा क्वेश्चन है, देख के ही लगता है ना, ओ माय गॉड इतना लंबा क्वेश्चन है, कब पढ़ूंगा, आई हैव ओनली 1 minute टाइम और 63 सेकंड टाइम से ज़्यादा थोड़ा सा टाइम है, हाउ कैन आई डू दैट? नो, डोंट डू दैट. सम ऑफ द क्वेश्चंस you can answer easily within 30 seconds. Okay, and some of the question you have to think, so that way the time will be managed, but your thinking should be clear and your brain should not take additional tension, stress. उसमें प्रॉब्लम हो जाता है, उसमें दिक्कत हो जाती है, ठीक है। सो उसको ध्यान रखो, ठीक है। सो योर माइंड शुड बी ट्यून्ड इन दैट वे दैट आई एम गोइंग टू गेट अ लेंथियर स्टेम, but the topic will remain same, the concept of physiology is going to remain same. No one is going to change the concept of physiology. And in physiology, you know, it's not like medicine. Every year we are going to change the, I mean, line of management, or I'm going to change the SOP. No, this kind of thing is very less in physiology. So that way the core concept will be remaining same. That's why I told you that whenever the session will progress, I'll show you that what is the current trend in the last 5 years, what are the core topic where you have to focus. I have shown you the topics which have been focused for to before 2021, but I will show you the recent one also. Now to look at this question. So this is one of the important conceptual question. This kind of question will be again asked. So whenever you are looking at the old age lung, so just think old age lung means the features will be similar to like that of emphysema patient. You know emphysema, you have read detail about emphysema. So emphysema mein the type of spirometric problem, similar kind of spirometric problem will also be seen in case of old age person, because the mucociliary clearance will be damaged. So increase mucociliary clearance, this is false, okay. VQ mismatch is corrected is not going to happen, it will be more VQ mismatch. Increase chest wall compliances, increase chest wall compliances is not possible because in old age the chest wall become more rigid. But whenever I am saying that old age lung behave like a patient of emphysema lung, then what the thinking should come into your mind whenever you are looking at this word compliance? Could anybody recall that compliance, यहाँ पे जो compliance देख रहे हैं ना, if I read the question for the first time, I should check that which compliance they are talking about, chest wall compliances or the lung compliances, because in case of emphysema as well as in case of lung, what will happen to the compliance, and in case of old age lung, what will happen to compliance? Compliance increases, but here which compliance they are talking about? Chest wall compliance. Chest wall compliance decreases, but lung compliance increases. So please remember this kind of core concept, that in case of emphysema, in case of old age lung compliance increases because of the destruction of the elastic tissue in this condition. So that's why lung compliance, only the compliance of the lung will be increased, but chest wall will be rigid. So chest wall compliance will be decreased. And why there will be increase in FRC? Increase in FRC is true because there will be increase in residual volume in both the cases of old age lung as well as emphysema patient. Okay. So again, this is a core concept which you should not miss. I'll show you the core concept again later on. Yes, so lung compliance increases, but chest wall compliance decreases. That is the scenario in old age as well as in case of emphysema patient. Now, during exercise, rapid breathing possible by which center? Why I have kept this question here? I know that you are doing PYQ, so immediately you are going to give you the answer that it is the VRG, because VRG contain one center which is known as the pre-Borginger complex, and this pre-Borginger complex is known as the pacemaker. So whenever you are increasing the rate and depth of breathing, you have to stimulate the VRG only. So VRG is the answer of this question. Okay, but again, apart from that, what you have to concentrate, that one of the important core concept is that during exercise, if I ask you why the increased breathing happens, so please remember this important concept also, that during exercise, increased breathing, rapid breathing is due to stimulation. Which kind of stimulation? Psychic stimulation and stimulation from proprioceptors from joints and muscles. So if I ask you same question, but I will ask you in a different manner, that one person is doing bicycling. Okay, one person is doing exercise. Which kind of exercise? Bicycling in a lavatory. Immediately after starting of the exercise, the breathing rate of the person increases. What could be the possible cause of this increased breathing rate? So your answer will be that it is the psychic stimulation as well as the proprioceptive stimulation. Psychic stimulation is also responsible for increased breathing even before the start of exercise, even before the start of exercise. Getting my point? So please remember this important concept of exercise physiology. Although I have not kept it under the core concept, but you know, exercise physiology can be always asked. Okay, so for exercise physiology, you have to remember that just after the starting of exercise, there will be increase in ventilation, increase in breathing rate. That is due to the proprioceptor stimulation to the respiratory center. Which respiratory center? The main respiratory center or the pacemaker of respiration, which is that is the pre-Purkinje complex, which is a part of the ventral respiratory group of neuron or VRG. Okay, chalo. Now next is that Bain-Briggs reflex. So here, so I told you that before 2021 reflexes was an important question. Okay, so Bain-Briggs reflexes, here all of you can answer easily, but I'll say remember like this, that in case of Bain-Briggs reflexes, what is the main thing I have to look for? I have to look for that heart rate must be increased. Okay, heart rate must be increased. This can also be answered, this can also be answered. Okay, even injection of saline directly in the right atrium can also be answered. But if I have to choose only one, then right atrial engorgement is the more common answer in this question. Okay, increase venous pressure cannot give you guarantee that there will be increase in there will be stimulation of the Bain-Briggs reflex. Suppose the veins are already distended, one person is suffering from varicose vein, there is increased venous pressure, but that does not guarantee that there will be increase in right atrial volume. So Bain-Briggs reflex will only be activated whenever there is increase in venous return. Increased venous pressure does not guarantee that there will be increased venous return. Okay, because you have to look at that whether the venous return is increasing or not. If the venous return is increasing, then and then only there will be activation of Bain-Briggs reflex. So right atrial engorgement is the main answer that should be given in this question. So apart from this Bain-Briggs reflex, you have to remember that in case of Bejol-Jerry's reflex, what will be the symptoms? Suppose you are getting a question on Bejol-Jerry's reflex. What symptoms you have to look at in the stem of the questions? There should be hypertension or hypotension. So there should be decreased blood pressure. There should be decreased heart rate. Along with that, there will be apnea. Along with that, there will be coronary vasodilation. Coronary vasodilation. I believe you remember all these things. And apart from that, you also have to remember that there is another reflex in the cardiovascular system, that is the Cushing reflex. So in case of Cushing reflex, if you compare these three, then there will be increase in blood pressure, so hypertension. Along with that, there will be decrease in heart rate, bradycardia. Along with that, ventilation will be irregular type of ventilation or respiration. So these are the triad of Cushing reflex. So this kind of question they were asking previously, but even this topic is also very crucial in recent MCQ also. Okay, so these reflexes you have to read. Okay, now if you look at few MCQs of the NEET PG 2022, so one of the important question, a little tricky question that was asked is that CPD solution is better than ACD solution. Who will tell me the answer of this question? Who will tell me the answer of this question? CPD better than ACD. What will be the answer? Okay, so in this question, the answer will be there will be less decrease in the 2,3-DPG, because you know this acidic solution is an inhibitor of the mutase enzyme. Okay, so mutase enzyme will be inhibited. Because of the inhibition of this, there will be less decrease in the 2,3-DPG. Okay, so quickly we will follow the other MCQs. VQ ratio is infinity. I told you that this is a very important topic, and it is one of the important topic in recent year also, that VQ ratio, like they are giving multiple questions. So VQ ratio infinity means I believe that you know that whenever the VQ ratio is 0, that means it is nothing but the bronchial obstruction, where the ventilation is obstructed but perfusion is continued. But whenever the VQ ratio infinity, that means it is the embolism, or it is the obstruction of the circulation, circulation obstruction at the level of pulmonary vessel, vessels. These are the core concept. So whenever there is VQ ratio infinity, that means in these cases you have to remember, I'll teach you this topic at the end of this session. This is one of the core topic. So pressure in the oxygen in the alveoli is lesser, so this is wrong. You will get to know why this is wrong. Partial pressure of oxygen and carbon dioxide is equal. This is also wrong. 159, this is also wrong. 40, this number is also wrong. So all these three options are wrong. Only the correct option here is the option number D. C will be correct. So I'll write down here whenever the VQ ratio. Okay, so now you quickly revise. So this is one of the core concepts. So you should not forget, whenever the VQ ratio is 0, what will happen in these cases? Okay, PO2, partial pressure of oxygen, okay, will be 40. Partial pressure of carbon dioxide will be 46 at the level of alveolar. So this is the alveolar gas composition. And whenever your VQ ratio is infinity, in these cases partial pressure of oxygen will be 149, not 59, and partial pressure of carbon dioxide will be near equal to 0. That's why if you look at these two number, 40 is also wrong, 59 is also wrong, it should be 149. Okay, so that's why the option C is also wrong, and obviously the B is also wrong, and A is also wrong. Only option that is correct is that if there is pulmonary embolism, because I told you that VQ ratio infinity means there is blockage of the circulation, so that is a pulmonary embolism. So obviously the gaseous exchange is not going to happen, right? So this kind of core concept you should not forget, because you know this time all of you know that the question pattern is going to be changed a little bit. The lengthier question will be there, and you will get more time to think of, but negative marking has very important in this NEET PG. So you have to be very cautious before answering, okay, because negative marking is going to give you more damage in the exam, right? Okay, chalo. So the next thing, at the high altitude, so answer batao. It's a very important question again. So yes, so at altitude of 3000, person complain of breathlessness. So most probably the person is suffering from acute mountain sickness. So in this acute mountain sickness, what is the most important treatment? The most important treatment is the oxygen supplementation and immediate rapid descent to improve the oxygenation. Acetazolamide is also given in this patient because in future he require a quick acclimatization. So all these three are used for this patient, but intravenous digoxin has no role in this person. So this is an easy question but core topic. Now another question, a patient with multiple sclerosis. So again this kind of question is going to come in future in this year also, okay, but more lengthier, more clinical type of question will be given. Okay, metabolic alkalosis I don't think इस सेशन में possible होगा, because I told you this is not the discussion session per se. Okay, so here you know कि loss of oligodendrocyte, loss of myelin sheath, both are correct. So which I should choose in between these two options? A, B, both are correct. So they are asking you that low nerve conduction velocity. This is the target of the question, that low nerve conduction velocity. I know that in multiple sclerosis, the cell which is going to be damaged is oligodendrocyte. So loss of oligodendrocyte is the pathophysiology of multiple sclerosis. Because of the loss of oligodendrocyte, myelin sheath will be lost, and because of the myelin sheath is lost, the conduction velocity is going to be reduced. So that's why this option B is directly related to the question, that why there is low conduction velocity in multiple sclerosis patient. This is the question. I'll show you another question which has been asked recently, where they are directly asking that in multiple sclerosis which cell is going to be damaged. So their answer is direct, the oligodendrocyte. But here the target of the question is low conduction velocity. Why? Conduction velocity is directly related to myelination. So that's why if I have to choose only simple one answer in this question, I'll go for loss of myelin sheath before option number A. Okay, because that is directly related to conduction velocity. ठीक है. So ये देखो, ये जो क्वेश्चन हम लोग डिस्कस किया ना, these are the questions which they were asking before 2020, but from your answer in the chat boxes I can easily understand that you have also practiced some of the MCQs which are old. I mean old means before 2021, and that's good, because you know in physiology no MCQ is older, because some of the topics or most of the topics are the same topic which was asked in the previous year also and this year also, because I told you repeatedly that फिजियोलॉजी में बार बार हम लोग गाइडलाइन चेंज नहीं करने जा रहा है, रोज रोज नया कुछ ऐड नहीं करने जा रहा है. द कोर कॉन्सेप्ट रिमेन द सेम इन फिजियोलॉजी. ठीक है, सो इट्स गुड. नाउ द रिसेंट वन. So NEET PYQ trend 2021 onwards. So here, as you can see here in this graphical representation, 2021, 22, 2023, 24, 25, all these last 5-year questions, I have checked that what are the type of question they are asking in the last 5 year. Okay. And I have kept all these x-axis at the different topic: general physiology, CBS, respiratory, renal, GIT, neurophysiology, endorepro. So now you will be able to see here clearly that previously we have seen that before 2021, neurophysiology was the target area and respiratory system was one of the main target area. CBS was there, renal was there, but those are the two areas where the maximum questions are coming. But now if you look at again in recent year, again the same trend. Neurophysiology is one of the topic where the maximum numbers of questions are being asked. And recently, general physiology has also given more important. Okay, so I have to concentrate not only the neurophysiology, obviously neurophysiology I have to concentrate for the NEET PG. I have to also concentrate on the, general physiology, I have to concentrate on the general physiology. So these are the two main core topic. Along with that, respiratory system is still there. Respi is also there. Getting my point? So if you look at the Purana trend and new trend before 2021 and even till today, your target area is not changing in physiology per se. Okay, because it's my subject, so I'm talking about my subject. I don't know about other subject. Okay, so other respective teacher will discuss that. But for my subject, for NEET PG, you must have to revise your neurophysiology, including the nerve muscle physiology and CNS physiology. That is in combination neurophysiology. And you also have to concentrate on general physiology. Don't ignore that. Recent year में general physiology लेके they are giving calculation type of question, they are giving conceptual question, they are giving multiple type of question. Okay, and respiratory physiology is again one of the important thing. Okay, so now we look at that what are the core concept or core topic where the questions are coming. Now look at this slide. This slide you should share with your friend also, so that they also know what are the core topic they should concentrate. But I believe you are going to do that or don't do that. I don't know, because obviously your friend is also your competitor. Okay, so that's up to you, but whatever. So this is a slide where all the see directly they are answering that they are not going to share. बोलते हैं ना, शेयरिंग इज केयरिंग. ओके, शेयर करोगे तो कोई लॉस नहीं होगा. आई एम टेलिंग यू. ओके, योर फ्रेंड मे नॉट बी योर कॉम्पिटिटर दूसरे जगह में बड़े हो रहा है. ओके, चिंता मत करो. सो शेयरिंग करो, नो प्रॉब्लम. यस, यू शुड हेल्प. ओके, एंड दैट विल बी अ ब्लेसिंग. ओके, हम लोग बोलते हैं ना, कोई नहीं देख रहा है तो किसी का हेल्प कर रहा है तो ऊपर वाला देख रहा है. सो ही इज लुकिंग एट यू. ओके, यू डोंट नो, इन द एग्जाम हॉल सडनली कोई आइडिया क्लिक किया, वो आइडिया नॉर्मली शायद आपका क्लिक नहीं करना चाहिए था, बट क्लिक कर गया. दैट इज वी से ना ब्लेसिंग्स. ओके, स्पिरिचुअल टॉक हो रहा है, बट फॉरगेट अबाउट दैट. सो हेल्प करो, शेयर करो, बोलो लोगों को दिस इज अ टॉपिक सर इज सेइंग कि ये सब टॉपिक आपको पढ़ना है ना. अभी देखो इन दिस स्लाइड, अंडर जनरल फिजियोलॉजी एंड अदर टॉपिक्स, some topics I kept in bold later. So this bold means these are the evergreen topic in physiology. I use this word evergreen, means always these topics are coming in physiology. Always. Any year questions, any kind of question, whether it is NEET, whether it is FMG, whether it is NEET, you open up the physiology paper, questions will be from RMP, question will be from action potential, question will be from VQ ratio, high altitude physiology, नर्व फाइबर क्लासिफिकेशन. बार बार बोल रहा हूँ, ये टेबल बहुत इंपॉर्टेंट है कि कौन सा फाइबर एनास्थीसिया में मोस्ट ससेप्टेबल है, कौन सा फाइबर प्रेशर में मोस्ट ससेप्टेबल, हाइपोक्सिया में ससेप्टेबल. ओके, पेन इज कैरिड बाय व्हिच फाइबर, स्लो पेन, फर्स्ट पेन, ऑल दिस फ्रॉम द टेबल ऑफ नर्व फाइबर क्लासिफिकेशन, राइट. बोलेंगे हाई ऑल्टीट्यूड फिजियोलॉजी का ट्रीटमेंट मैंने रखा बिकॉज दैट इज वन ऑफ द कोर टॉपिक. ओके, स्लीप फिजियोलॉजी में द ईजी चेंजेस इन स्लीप फिजियोलॉजी as well as the identification of the EEG, I mean identification of the sleep pattern. Like for example, for rapid eye movement sleep, you first have to look at the recording of the EMG because EMG should be completely flat. Okay, that indicate the muscle paralysis. So this kind of concept you should read. Okay, and this topic where I have striked out, these are the topic which was very famous before 2021. Okay, so this aquaporin topic, this filtration barrier and which substance will be filtrate, which will not be filtrate, the CVS reflexes, the JVP in the CVSs, okay, oxygen hemoglobin dissociation curve, respiratory centers, all these topics were more famous before 2021, but that does not guarantee that it is not going to come. So whatever topic has been listed in this slide, you have to concentrate on this topic at the 11th hour before going to your exam hall. Am I clear? Okay, so please keep a snapshot of this topic. Okay, you have to read this. Like for example, currently if you look at the endocrine physiology, you have to read the cell signaling, okay, and different receptor and insulin release mechanism, how they are released, and how the menstrual hormone changes during the menstrual cycle. So all this topic you have to read, okay, because current questions are coming from there. Okay, apart from there, you can also see the glutes is also important. I told you the general physiology is recently becoming very famous. Okay, so they are giving question from control system also. They are giving question from cell cytoskeleton. What are those? The I mean microtubule, microfilament, intermediate filament. They are giving question based on this topic. Okay, and they are also giving question about cell junction, cell to cell junction, tight junction लेके question दे रहा है, gap junction लेके question दे रहा है, desmosome लेके question दे रहा है. So all these things are becoming more important in current years, right? So please concentrate on this core topic. Okay, now I will show you some recent MCQs which has been asked after 2021. So NEET PG 2021 का question देखो. So if you look at the question stem is like a clinical kind of scenario. Again, I am saying this year also you are going to get this kind of clinical scenario based question. So I told you repeatedly that by looking at the stem of the question, दिमाग को बंद नहीं कर देना है. Okay, because sometimes what happen, looking at a long stem of questions, our brain get fatigue. Oh my God, क्या लंबा question दिया है, पढ़ना तो होगा ही. Okay, but if you look at the question at the last line, they are asking a pretty simple concept of physiology. That bhai, glucose absorption in the gut is based on which GLUT or which SGLT? That is the question. Okay, that is the question, right? So if that is the question, so इसको लेके चिंता क्यों करना है? So इसलिए whatever may be the stem of the question, it may be long, it may be short. पहले देखो, don't take tension. Maybe you should read the last line first and then go back to the reading the long stem of the question. Maybe sometimes this may click in case of particularly the section A physiology and anatomy type of question. Last line पहले पढ़ लो, उसके बाद पूरा question एक बार पढ़ के आंसर करो because you will get more time this year. Okay. So now you all know that if this is the question, then in GIT glucose absorption is done by SGLT1. So that is the answer because SGLT1 is going to absorb glucose as well as galactose. So ORS solution contain glucose that is going to be reabsorbed. But you also know that if the question is the glucose absorption from basolateral aspect, then what will be the answer? In this question, suppose a same question, a 7-year-old child given ORS solution, glucose absorption from the gut, glucose absorption from the basolateral membrane of the gut. I have just changed the question by putting an extra word. Glucose absorption from the basolateral aspect of the gut is absorbed by which one? Okay, then your answer will be GLUT2. Very good. Okay, GLUT2 is going to reabsorb all glucose, galactose, fructose from basolateral membrane. Okay, so basolateral membrane होगा तो ये आंसर हो जाएगा. Otherwise, if the question is not mentioning whether it is luminal membrane or basolateral membrane, okay, luminal membrane, basolateral membrane नहीं बोला है तो we will think of luminal membrane only because that is the main part of the glucose reabsorption from lumen to cell. And from cell to blood, that is the basolateral membrane. Okay, but that should be mentioned in the question that basolateral membrane mention है, तभी हम लोग GLUT2 को मारेंगे. Otherwise SGLT1 is the answer. ठीक है, SGLT1 is associated with. Okay, Okay. No, that SGLT1 is associated with the GLUT1 that is in the renal system. That's why this is a tricky concept, mind there. Okay. So in renal system, GLUT2 is, I mean, SGLT2 is also there, SGLT1 is also there. SGLT2 is the major glucose absorption in renal system, that is a PCT. Okay. So there SGLT2 is coupled with GLUT2, and SGLT1, which is responsible for 10% glucose reabsorption, that is coupled with GLUT1. बट हियर दिस इज कपल्ड विद GLUT2. ये छोटा छोटा जो डिफरेंस है ये वैल्यूएबल है, इंपॉर्टेंट है. ओके, ये सब मिस नहीं करना है. ठीक है, एवरीबॉडी क्लियर? ओके, नाउ अनदर क्वेश्चन सी. नाउ लुक एट. Okay, so now here if I look at the question, which cells are most commonly affected in such condition? Question is not clear. Now I have to read the whole stem of the question. There is no other way out. But even before looking at the last sentence, if I look at here, my brain already start thinking about the multiple sclerosis, because I have not read the whole question yet. Okay, but I have read the last question. But before reading the last question, this word is coming in my mind, flashing in my eyes, that multiple sclerosis. So now my brain has started thinking. In the last 30 seconds, my brain is thinking multiple sclerosis का क्वेश्चन. अभी पढ़ लेते हैं. एक्स्ट्रा तो कुछ नहीं बोला है, नहीं एक्स्ट्रा कुछ नहीं बोला है, क्वेश्चन इज डायरेक्ट. So now I'm 100% sure that I'm going to mark it is the oligodendrocyte. Okay, so this kind of approach you may use. Okay, read the last line and then go back to the main question. Sometimes last line पढ़ने से ही आपका आइडिया आ जाएगा क्वेश्चन में क्या पूछने जा रहा है. Now your brain will start thinking in that direction, so that will reduce your time. Okay, and this will also remove the fatigue by reading the long question and then looking at the last line. Okay, so this trick you also use in solving the MCQs. Okay, this may be beneficial for some of you. Okay, now another question. Say again, the long stem of question. If I read the last line, which is best suited for this description? Now I have to read the description only. Now I have to be more careful because the description is the question. Getting my point? Reading at the last line, here the answer is not coming up. But okay, but here it is said that which of the following suited for this description. Now I have to read this description very carefully. In this description, one important word has been found, that is stable stand, and it's a cell cytoskeleton. So whenever this is coming, that it is cell cytoskeleton, so we know microtubule, microfilament, intermediate filament. ये तीनों में से microtubule, microfilament, they are dynamic one, they are not stable stand. Only important one is the stable one, that is the fixed structure, that is the intermediate filament. So मेरा आंसर हो गया. समझ में आया? All of the above cannot be the answer because this word is changing here. It is not the question of all cell cytoskeleton. Okay, this is not the question of microtubule or microfilament. The C will be the answer. Okay, because microtubule, microfilament, they are dynamic. So what dynamic means? What dynamic means? They are not stable, they are unstable. Means if the length of the cell is growing, the cytoskeleton will also grow. Okay, and if the length of the cell is not growing, the cytoskeleton will remain fixed. That is the meaning of dynamic. But static cytoskeleton means that is a kind of stable cytoskeleton, and that is the intermediate filament. And dynamic one is the microtubule and microfilament. ठीक है? Yes. Now, in NEET 2022 onward, if you look at the question, suddenly more question was based on images. Okay, and in a recent FMG exam, there was a question on video based question. So you may also get a video in your question also. Okay, again my advice, don't get panicked. Okay, वीडियो जो देगा सिंपल वीडियो ही देगा आपको. नेटफ्लिक्स का वीडियो तो नहीं दे देगा ना कि आपको बहुत देर तक सुनना होगा, उसके बाद यू आर गोइंग टू अंडरस्टैंड. ओके, फ्यू सेकंड्स के लिए वीडियो देगा. डोंट गेट पैनिक्ड, लुक एट द थिंग्स. मोस्ट प्रोबब्ली यू नो द थिंग बिकॉज यू आर रीडिंग सो मच. ओके, सो योर कॉन्सेप्ट इज देयर, just your brain has to click. Okay, how the brain can be clicked? Because you know, whenever you are reading something, every information is going to be stored at your subconscious mind. Okay, your subconscious mind is going to give you the answer. Okay, but you have to be positive in that respect. Okay, positive means you have to be confident that I have read, I have revised, I have followed all the advice that my teacher has told me so far. So obviously I'm going to give answer of most of the questions correctly. This kind of confidence, this kind of faith should be there inside your brain. Then and then only your subconscious mind is going to wake up. This is not my language. This is language collected from multiple books. Okay, so if you read all these books, okay, of science and spirituality, you will be get to know that your subconscious mind is guiding you. It is giving you answer, but for that you have to be careful that you are waking up your subconscious mind. If you get frightened, if you get tense, if you get stressed, and if you don't have faith on you, then your subconscious mind may not be going to click in the exam. Okay, so please be positive. Okay, होगा, आंसर कर पाओगे, that should be the confidence. Okay, now this is the question why I'm keeping it here, because I believe you know the answer. That answer will be the, what will be the answer? Answer will be the shivering. Okay, because in this graph what you're finding out that whenever a person is suffering from fever, onset of fever, the pyrogens will be released in the blood, and that pyrogen is going to act at the level of hypothalamus, because all of you know the thermoregulatory center is located at the level of hypothalamus. So whenever this pyrogen is acting at the level of hypothalamus, what will happen? The hypothalamus will raise the set point of our body temperature. Set point ka raise kar dega. Means hypothalamus is saying that because the pyrogen, the body temperature should be at 103 degree Fahrenheit. But our normal body temperature is 98 के आसपास. So now the body has to gain certain temperature to match this set point, because hypothalamus is saying that body temperature should be 103 degree, but my body temperature is 98 degree Fahrenheit. Okay, 98 degree Fahrenheit. So what I have to do? I have to match the set point. I have to match the hypothalamus. How can I match? I have to reserve temperature inside my body. How can I reserve my temperature inside my body? By curling of this body. Okay, by shivering, because whenever shivering the body will produce heat. So all this is going to happen during this A, and because of this thing the body will gain some temperature, and that is nothing but your onset of fever. So now because of this shivering and all, the body has gained heat, and now the body temperature is matched with the hypothalamic set point. Now after matching, if you give certain medicine, okay, suppose you have given paracetamol. So whenever you're giving paracetamol, you know the fever is going to subside. So suddenly the hypothalamus will decrease the set point to a very low level. Okay, hypothalamus now it is saying that now the body temperature should be normal. Now the body temperature should be normal, right? Now whenever this hypothalamus is saying that body temperature should be normal, my body temperature is already high, that is the fever. Now I have to lose the heat from the body. How can I going to lose my heat from the body? By sweating, by vasodilation, by stopping down the thermoregulatory process. So all this thing is going to happen at point number B. Okay, at point number B, not at point number A. So that's why what will happen at the point A in comparison to point B, the shivering is going to happen during this generation of the heat, and this is the portion where the body is losing heat. So losing heat means there will be vasodilation, there will be sweating, and etc. Important one. Okay, so thermoregulatory system is a negative feedback control system, but also feed forward control system. I believe you remember that. Okay. Now again an image based question in the same year, and this image is becoming famous recently. They are continuously asking what happens during this 1B period, and I believe you all know that this is the phase where the law of Laplace is applied. Along with that, the concept of plasticity, as well as the concept of law of Laplace. Okay, so law of Laplace question पूछे, okay, और द प्लास्टिसिटी प्रॉपर्टी पूछे, जो भी बताओ ये दोनों आपको आंसर होगा. Okay, first arch is 150. Yes, you are absolutely correct. The first arch 150, and this is the extreme sensation of fullness. That's why you can see here that whenever the urinary bladder contains 400 ml of urine, now suddenly there is increase in intravesical pressure. That is due to the onset of the micturition reflex. This is due to the onset of micturition reflex. Okay, so this is the onset of micturition reflex. Got it? So these are the question in NEET 2022. Another question. So this is a single liner question, but again I am saying this year single liner question will be converted into a long stem kind of question. So you should be prepared for that. So answer of this question, what will be the answer? Bolo, answer batao. So you have to remember certain nucleus of the basal ganglia and their disorder, okay, like Parkinsonism disease, like your Huntington disease, like hemiplegismus, like dystonia. All these 4 diseases you have to remember that which nucleus is responsible for this kind of disorder. Okay, that is there. Now in the NEET 2023, Question again, the question is based on the images. So one images is given where you can see a carrier protein or the transporter protein. So in this carrier protein there is changes in the shape and the substance is binding with the carrier protein. So this is a typically kind of what kind of transport? This is a kind of facilitated diffusion. Okay, facilitated diffusion. क्या डिस्कशन चल रहा है? Okay, कोई बात नहीं. Chalo. So now next another question. Again, this is an image based question. So here in this image, you look at the x-axis first and then y-axis first. So if you look at the x-axis, you are finding out the different parts of the nephron has been given like Bowman's capsule, proximal tubule, distal tubule, urine. Okay, and in y-axis, percentage of filter load has been given. So one substances where no filtration, no secretion is seen, that is a straight line. So this is typically of inulin, right? This is typically of inulin, and here option D, so there the substances must have to be secreted. So this is typically of the PAH, para-aminohippuric acid. So this is again one of the important concept that you have to remember. Now if you look at the this curve B, so the B is showing that there is continuous reabsorption is going on, but even after full reabsorption, certain amount of substance is still remaining at the level of urine. So it can be sodium, or it can be bicarbonate, or it can be water, this kind of substances, that is on B. And A is the substances where 100% reabsorption is happening within the 100% reabsorption is happening within the proximal tubule. So A probably the glucose and amino acid. Very good. So here the answer is going to be the para-aminohippuric acid. Okay. Okay. Now another image based question in the same year, that is 2023. So again, this is the question based on the spirometer, and here you can find out that this is the expiratory reserve volume ERV, and this is the residual volume. So combination of these two is known as the functional residual capacity. So easily you can answer that is the FRC is the answer of this question. ठीक है. So now you are getting ना कि you have solved the question, PYQ solve किया है, plus now I am showing some of the MCQs in the last 5 years. So now from here you can easily going to get the gist that what is the core topic where I should concentrate. Coming to the NEET 2024. So now this a more complex type of questions are coming. Here you have to match that which receptor is matched with their appropriate stimulus. So Ruffini's corpuscle. So Ruffini's is mainly for detection of the stretch on our skin. So this is true for the Ruffini's, not the sustained pressure. Sustained pressure is by Pacinian. So this is not true. This is not true. Merkel's. Merkel's is for point stimulus. Merkel's is for detection of point, corner, edges. It is not for slow vibration. Slow vibration is a feature of Meissner's. Slow vibration is a feature of Meissner's. So this is also wrong. Meissner corpuscles is for stretch. I already told this is not for stretch. Pacinian corpuscle is first vibration. So see here, this question has also been asked in previous year question also, before 2021 also, that which one is the best receptor for vibration. That was the exact question, single liner question. But now in the recent year, they are giving you the same topic in a different manner. Now you have to mix and match with multiple options. Okay, so now please be careful, and your mind should know that I'm going to get a more lengthier question, more complex scenario question, but my subconscious mind knows everything because I have read everything. Please remember this important, advice in your brain, that your brain knows everything. Your brain has read many things. All of these informations are there in your subconscious mind. Whatever you complain that I'm forgetting, I'm not remembering, this is true for every student. You are not exception. Please trust my word. Okay, this will give you more confidence, and that confidence will wake up your subconscious mind in exam hall, right? Getting my point, dear student? Okay, so please remember those things. Okay, now another question. Again, see, the question is becoming more complex. So now you have to arrange this sequence. Okay, so three things has been given, 1 2 3. This is the event which is happening at the neuromuscular junction. So whenever I'm reading these options, what I'm going to look at, okay, you have solved the MCQs, but how to solve the MCQs? You look at that what is happening This is sodium channel open in the end plate. So this is talking about the muscle membrane का बात कर रहा है. कैल्शियम एंटर एट द नर्व टर्मिनल. सो नर्व टर्मिनल जब भी बोल रहे हैं ना, ये प्री सिनेप्टिक टर्मिनल का बात हो रहा है. सो ऑब्वियसली प्री सिनेप्टिक टर्मिनल का इवेंट पहले होगा. एंड द थर्ड वन, रिलीज ऑफ एसिटाइलकोलिन. सो दिस इज ऑल्सो गोइंग टू हैपन फ्रॉम द प्री सिनेप्टिक टर्मिनल. सो ऑब्वियस थिंग इज दैट 2 and 3 ये दोनों पहले होगा, उसके बाद ही हमारा 1 आएगा. Right now between 2 and 3, which is more important, because we all know that first calcium has to enter in the presynaptic terminal, then and then only the calcium entry will lead to release of neurotransmitter. So option A, how can it be the answer? It cannot be the answer, because first of all the neurotransmitter has to be released from this presynaptic terminal. And how the neurotransmitter is going to released? Calcium will enter, that will release the acetylcholine, and that acetylcholine is going to act on the motor end plate, that is the muscle membrane, and the sodium is going to enter through this acetylcholine receptor. So what will be the correct answer? Correct answer will be option number D, right? So please solve more PYQ. Even if you have solved only once, revise them again once again, because revision is the key to the success. I told you repeatedly that key to the success is revision. 3 बार बोला मीन्स 3 बार रिविजन होनी चाहिए बिफोर योर एग्जाम. एवरी टॉपिक शुड बी रिवाइज 3 times. इवन इफ 3 is not done, at least 2 times revision is essential. Otherwise only reading once is not going to give you the answer. It will give you more confusion in your exam. Okay, so please you have to revise. Okay, now another MCQ. See, a long stem of question. Okay, exactly the question that you are going to predict in the upcoming exam in 2026. You are going to predict that this kind of question is I'm going to get in my exam. Okay, so a long stem of question. Okay, and the question is that whenever the a person is taking a bath with the lukewarm water, why did she experience pain? So lukewarm water is giving you pain sensation. This is obviously not normal pain sensation. Okay, you are not going to get the pain sensation, but you are getting it. Okay, so why? This is hyperalgesia. Answer is no, this is not hyperalgesia. So whenever I am getting hyperalgesia, my option is removed automatically. Okay, and because the temperature is only 40 degrees centigrade, the nociceptor is not going to be activated in this condition. So these are also removed, because nociceptive pain, how much temperature is required? Greater than 50 degrees centigrade is required. No problem. Okay, underrated, overrated, फर्क नहीं पड़ता है मेरे को, because I want to keep I want to keep myself low. Okay, so that is good for me. Okay, no problem dear. Okay, thank you so much for your love and respect. That is all what I want. Okay, underrated, overrated, it doesn't matter. That's why you must be saying that in Instagram and all this. I'm not going to, not very active in that. Okay, because that does not matter. Even the 40 student, 30 student who are listening, if they are giving you respect and if they are loving you, that is my everything. Okay, chalo, no problem. So now, so obviously the answer is going to here the innocuous stimulus. So please remember 2 important words. One is hyperalgesia, one is allodynia. Although this concept I told you repeatedly. So whenever you are looking at hyperalgesia cases, the stimulus should be a pain producing stimulus. And in that pain producing stimulus, if you are getting extra pain, exaggerated pain, that is known as the hyperalgesia. Okay, so the stimulus is giving a little pain, normal case mein, but if that little pain is giving you huge pain, then that is hyperalgesia. Okay, so the stimulus is a noxious stimulus, not the innocuous stimulus, noxious stimulus. But whenever you are giving a stimulus which is not supposed to give you pain, like for example touch or little warm water, if this kind of stimulus is giving you pain, then that is known as allodynia. ठीक है, ये दोनों एकदम क्लियर होनी चाहिए. ओके, नाउ ये जो देखो, ये मैंने उस टाइम में डिस्कस कर रहा था ना कि VQ रेशियो इन्फिनिटी. यू हैव सीन दैट देयर वाज एन MCQ व्हिच वाज आस्क्ड बिफोर 2021 MCQs, and that question was directly asked, which of the following is true about the VQ ratio infinity. Now they are giving you the similar kind of question where a graph is given, additional image is given. So the question is becoming more complex. Okay, because now sometimes I have seen that students whenever they are looking at the graph ना, ग्राफ देख के उसका दिमाग खराब हो जाता है. ग्राफ दे दिया, अरे देखो तो सही, व्हाट इज देयर इन द ग्राफ. ओके, You may be knowing it. Okay, look at the graph. No. Okay, because most of the cases graph देख के image दे दिया. Okay, I have not seen this image. I am looking this image for the first time in my life. ठीक है, कोई बात नहीं. Look at now what it is giving. So what it's giving? X-axis PO2, Y-axis PCO2. And this is the alveolar PO2 and PCO2. Now from my knowledge, baseline knowledge, because I have solved by PYQ, I know that whenever the VQ ratio is 0, PO2 was 40 and PCO2 was 46. I have written this information already. And whenever the VQ ratio is infinity, I have seen that PO2 is highest 149, PCO2 is 0, almost 0. Okay, almost 0. So now if I look at this graph, here I am seeing that VQ ratio infinity कौन सा point में indicate कर रहा है? This is the point where VQ ratio infinity मिल रहा है. So what is the meaning of this point? This point is, this is touching the x-axis at 150. What is this x-axis? X-axis is oxygen. So this is matching that oxygen is 150 at this point. And VQ ratio infinity, if I look at what is the carbon dioxide in the y-axis. So y-axis एकदम नीचे होते y-axis 0 पे आके यहाँ पे touch कर दिया x-axis में. Means at this point oxygen is 150 but carbon dioxide is 0. That is the meaning of this information and the graph. So दोनों match हो रहे. Now if I look at here that VQ ratio is 0. VQ ratio is 0. So what I know, my brain knows that VQ ratio 0 means oxygen 40 होगा, carbon dioxide 46 होगा. इसको match करके देखते हैं. So if I drop on perpendicular from here on x-axis, so this is my oxygen. कितना 40 match हो रहा है. ठीक है, match हो गया. If I drop a perpendicular from here on y-axis, this is around 45 or 46. So ये कौन सा? This is PCO2. So match हो रहा है. So this is the meaning of the curve. So now if I read the questions with this concept, okay, you are never going to miss the question. In a patient with pulmonary thromboembolism, boli diya ki this is VQ ratio infinity. Okay, at which point in the VQ ratio graph indicate the effect of this pulmonary embolism? Okay, so everything is already given in the questions. Everything is there in your brain. Only look at the graph carefully. Okay, don't get panic. Okay, so obvious answer is option number D, because that is the VQ ratio infinity. Pulmonary embolism means it is the infinity VQ ratio, and I told you that whenever there is bronchial obstruction, that is a zero VQ ratio. ठीक है, so इस question का answer हो गया, option number D is the answer. ठीक है, right. Okay, and now next one. A patient has the following values. Capillary hydrostatic pressure is given. So this is based on Stirling law. So some of the calculation is important in physiology, like cardiac output calculation you should know, and the Stirling formula you should know, and the Poiseuille-Hagen formula where the resistance is inverse of 1 r to the power 4. ये 3-4 formula आपको ध्यान रखना होगा. Okay, so according to the Stirling law, here the PC minus PT plus pi T minus pi C. Okay, so this is the net force. So in this question it is giving net force is equal to 0, hydrostatic pressure is 18, and ये मेरे को चाहिए, that is x, and this is basically 7 दिया है and this is 27 दिया है. So if you put this, then from here the x value will have -2. ठीक है, so again the answer will be this one. I told you the formula. Actually I am also going to take another session in the YouTube only, that is the RRR. Generally in that session I generally discuss more of the important topics, because this session is not that. This session is related to the PYQ discussion. Okay, so in that session I generally kept single liner, I generally kept mathematical problem and the important images. So that will be there before your exam. So you will be getting there. You will be getting there in that YouTube session only. Okay, so don't worry. Right. Now look at another MCQ. So this is one of the recent MCQ. So what is the answer of this question? So answer is option number C. So if you look at the release of insulin, the typical graph that is given, immediately there will be increase in insulin, followed by there is a dip. Then after 15-20 minutes, okay, after 15 to 20 minutes, again there will be increase in insulin secretion. ठीक है. So insulin immediately release हो जाएगा whenever the blood glucose is high. This releases from the preformed granules which are already present in the beta cell of the pancreas. Already जो granules already preformed है. Okay, and after 15-20 minutes new granules of insulin will be synthesized inside the beta cell. So that's why in between there is a break, there is a dip, and then further release of insulin after 15 to 20 minutes. So option C is the best answer in this question. So these are the important or typical or atypical MCQs where you can get an idea that what are the most important topics that I'm going to concentrate. काश कि इसके बाद 2026 का क्वेश्चन हम आपको दिखा दे पाते थे. ओके, बट वो नहीं है मेरे पास. 2026 का क्वेश्चन मेरे पास नहीं है. बट व्हाट आई टोल्ड यू ऑलरेडी, this I told you already, that these are the most repeated concept. Okay, most repeated concept are these. So this slide I told you that take a images of this slide or whatever, but these are the things which you should not forget. Okay, these are the core concept of physiology which you should not forget. So now among few of these core concept, okay, just hold on. Some of the core concept I'll show you that what are the things that you should remember from this evergreen topic of physiology. I told you na, some of the topics are evergreen topic. Okay, next YouTube session, there I'm so sorry, I don't remember actually, because I believe, okay, just let me check my schedule if I have written it. Okay. I think 15th of July, most probably 15th of July, right? Or maybe another YouTube session, but most probably it is 15th. Maybe different only, but if you are following my channel or something like that, you will get to know. Okay, don't worry. Okay, so now in this most repeated topic, I told you that certain topics are there in physiology which are evergreen topic. Always those topics should revise. Like for example, important points on RMP. Okay, so in my lecture class, whether it is RR or whether it is main lecture, all these points I have discussed repeatedly. So I'm not going to elaborate all these things, but I believe all of you know that permeability of different ion in cell resting cell membrane and the cell membrane RMP is close to and equal to this kind of questions they are asking in any type of question, any type of exam. So please be careful on this important information. Okay, this should be on your fingertips. Okay, read, revise at least 2-3 times. Okay, your subconscious mind is going to give you answer again and again. I'm saying you same thing. Don't get afraid. Don't say that I'm going to forget, I'm forgetting, I'm not remembering. These are common symptoms, but it is there in your brain. Okay, trust it. Right, now next, again an evergreen topic, action potential and ionic permeability. So in my class, in my RR, I told you repeatedly that this is first graph, this is the action potential graph. I am going to identify this action potential graph. If the graph is going in the positive direction also and it is going in the negative direction also, so this is the straight line, this is the x-axis. So x-axis के ऊपर भी जा रहा है and नीचे भी जा रहा है, then that is the graph which is the action potential graph. And along with the action potential, one graph is going above and suddenly going down. This is the sodium channel opening graph, and another graph which is going slowly upward and slowly downward. This is the potassium permeability curve. Okay, from here multiple questions will be asked, like for example, maximum sodium permeability कौन सा point पे होगा, maximum potassium permeability कब होगा, point where the membrane voltage is close to the equilibrium potential of sodium, point where membrane voltage is close to equilibrium potential of potassium. All these points you should revise and remember, right? Okay, next evergreen topic, recently this topic is gaining more importance, is the concept of gain of the control system. So there I told you now, they are giving you mathematical type of question, they are giving you conceptual question. So gain of the control system is again important. And if you are doing PYQ, you will get to know that gain of the control system question has already been given. So the correction upon error, this formula you have to remember. Like for example, here I have given example that suppose the blood pressure of a person is 100 millimeter of mercury, suddenly it is changed to 160 millimeter of mercury. Now the baroreceptor is correcting your blood pressure from 160 millimeter to 120 millimeter of mercury. So Original, the blood pressure was 100 millimeter of mercury. So even after baroreceptor correction, I can find out that 20 millimeter of mercury problem, 20 millimeter of mercury blood pressure is still there. I mean, that is deviation from the normal. So this is known as the error. And how much correction this baroreceptor system is doing? It is bringing the blood pressure from 160 to 120 millimeter of mercury. So the correction is 40. So by dividing these two things, it is the gain. Now, another important question which has been asked in INI-CET, that infinity gain. So infinity means in this correction upon error, if the error is zero, then the ratio will be infinity. So zero error means a control system is very, very effective, very, very strong, and that is the kidney, which has infinity gain for regulation of blood pressure and blood volume. ठीक है? Now the same thing हमारे सामने आ गया. This is from my RR lecture video. I have already explained this, that normal VQ ratio when it is 0.8, this is the normal VQ ratio. When the normal VQ ratio is 0.8, what is the partial pressure of oxygen at the level of alveoli? This is 100. What is the partial pressure of carbon dioxide at the level of alveoli? This is 40. And I already told you that whenever this normal value is going towards the infinity value, VQ ratio is infinity value, then what will happen to the partial pressure of oxygen? 149. And what will happen to the partial pressure of carbon dioxide? 0. And whenever the VQ ratio is becoming 0, the partial pressure of carbon dioxide will be 46, partial pressure of oxygen will be 40. Okay, so very, very important and evergreen topic in physiology, respiratory system and VQ ratio. Okay, respiratory system का VQ ratio is most important. Some of you are asking that treatment of HAPE and HACE किसमें steroid दिया जाता है, किसमें steroid नहीं दिया जाता है. Again I am saying, if the question is treatment of choice, neither steroid neither calcium channel blocker is the treatment of choice. Treatment is oxygen, because the problem in the high altitude is because of hypoxia. So hypoxia correction is the mainstay of this treatment. And what should be the treatment? Oxygen supply. Along with that, improvement of oxygen in the environment. How can I do that? By descending to the lower altitude and by giving oxygen supplementation. Getting my point? So that's why these are the most important treatment. If the question is most effective, most reliable, okay, most effective treatment for HAPE or HACE or high altitude problem, your answer is oxygenation and descend to lower altitude. Along with that, if the problem is acute mountain sickness or HACE, that is high altitude cerebral edema, then your treatment is corticosteroid. Okay, so acute mountain sickness and high altitude cerebral edema, what is the problem? Problem is increased permeability of the brain capillary, and to decrease that permeability, corticosteroids should be given additionally, but without bypassing the oxygen and all. Oxygen पहले देना ही होगा, उससे पहले नहीं. Okay, and if it is the high altitude pulmonary edema, high altitude pulmonary edema में the capillary is damaged because of the ischemia. So because of the ischemia, whenever I am saying hypoxia is the again problem, and that hypoxia causes pulmonary vasoconstriction, that's why the HAPE is going to happen. So how can I reverse that pulmonary vasoconstriction? By giving calcium channel blocker, because you know calcium is responsible for contraction of the smooth muscles of the pulmonary vessels, and because of the contraction of the smooth muscles of the pulmonary vessel, the pulmonary vasoconstriction is going to happen. So that's why I want to block that calcium channel which is causing contraction of the smooth muscles of the pulmonary vasculature. That will prevent the pulmonary vasculature constriction, and if that is prevented, then that is the treatment for HAPE. But again I am saying the origin of the problem is hypoxia, so oxygenation is the mainstay of the therapy, right? HACE के साथ HAPE भी था and answer steroid था answer. Okay, so if it is HAPE and HACE, so obviously the steroid should be given before the nifedipine, because you know the brain edema, particularly at the level of the white matter edema, is more important between these two problems. That's why you should be given preferences. But again, look at the questions, look at the symptoms. Okay, whether it is typically HAPE or HAZE or the mixed pattern. Okay, but if it is mixed pattern, the steroid दोनों में से if you have to choose only one, तो steroid should be given preferences. But steroid is not going to reverse the high altitude pulmonary edema. Okay, because the problem is not the increased capillary permeability, problem is vasoconstriction. ठीक है, right? Okay, another important and evergreen topic, I told you that nerve fiber classification, there is a table. That table you should revise. Apart from revising the table, what you have to read? You have to read that what are the fiber which are sensitive to local anesthesia. So this is a little controversial, but I told that A gamma, A delta followed by A alpha beta followed by BC. This you should remember. In pressure, what is the fiber sensitivity? A alpha, A, B, C. And in hypoxia, what is the fiber most sensitive? Along with that, spike duration for different fiber is also given here. Okay, again an important one. So these are the most important topic in physiology or the evergreen topic. And another topic I told you, the sleep physiology, which I already discussed a little bit, that how to differentiate between non-REM and REM sleep. Because if the EEG recording is given and EMG recording is given, to differentiate between these two types of sleep, I have to first look at the EMG recording. And if I'm getting in the EMG that there is no recording at all, there is only a kind of straight line and little bit of undulation of the line, then that indicates that is a silent EMG. But again, this topic has been discussed detail in RR video also as well as in main video. Okay, so these are the couple of topics which are core topic in the physiology. Now I believe you got the gist of this class. Now this is the last slide. According to my experience, if you ask me that, sir, apart from the topics which I have already shown you already, okay. Yes, paradoxical sleep is the REM sleep, because in REM sleep, EEG findings is completely different from the sleep pattern. EEG finding, EEG is beta-like EEG, which does not support the sleep. Beta means that is the person is awake, but that is person is not awake. So that's EEG is not matching with the sleep pattern. That's why that's a paradox, right? Okay. So again, oxygen hemoglobin dissociation curve is a very important topic in your upcoming exam. Central and peripheral chemoreceptor, whatever you have read, revise those things. Okay, I have listed this topic. This does not mean you have to read new things from here. The same thing you have to read and same thing you have to revise. That is the bottom line. Getting my point? Here I have listed the topic. That does not mean you have to read intricate detail of this thing. No. Whatever is there in the note, whatever is there in the class lecture, read those and revise those things, because revision is more important. So oxygen hemoglobin dissociation का सेंट्रल पेरिफेरल केमोरिसेप्टर क्या पढ़ेंगे? सेंट्रल पेरिफेरल केमोरिसेप्टर में ग्लूमस सेल क्या होता है, व्हाट इज द स्टिमुलस फॉर ग्लूमस सेल, सेंट्रल केमोरिसेप्टर का स्टिमुलस कौन सा है, ऑल दिस थिंग, व्हाट इज द प्राइमरी स्टिमुलस, व्हाट इज द मोस्ट सेंसिटिव स्टिमुलस, दोस आर द क्वेश्चन. Glucose transport maximum. So in kidney there is a condition which is known as the splay effect. So look at the splay effect and their curve. स्प्ले इफेक्ट का जो ग्राफ होता है, दैट ग्राफ एंड द स्प्ले इफेक्ट, दोनों चीज आपको पढ़ना होगा. कार्डियक पेसमेकर करंट, रिसेंटली दिस इज एन वेरी इंपॉर्टेंट टॉपिक फॉर INI-CET and it is also going to be given in your NEET exam. Okay, molecular motor and axonal transport, very upcoming topic. Okay, so recently they are getting that molecular motor and axonal transport is abnormal even in your Alzheimer disease also. That's why this topic is very crucial. Yes, you told me last time also custom module, let's discuss today with the team. Okay, thank you so much for the reminder. Smooth muscle contraction. So please look at the how the smooth muscle is different from skeletal muscle. There are certain point that the Z line is not present in smooth muscle, the T tubule is not present in smooth muscle, the troponin is not present in smooth muscle. All these things are important to read, very important. Okay, गैस्ट्रिक फेज ऑफ एसिड सिक्रीशन, क्यों नहीं, मेरे को लग रहा है ये लेके क्वेश्चन देगा. जो 3 फेज होता है ना, केफालिक फेज, गैस्ट्रिक फेज एंड इंटेस्टिनल फेज, एंड व्हाट इज द मैकेनिज्म ऑफ दोज फेज, बिकॉज वन क्वेश्चन हैज आस्क्ड रिसेंटली दैट सिक्रीशन ऑफ एसिड when you are looking at the food, what kind of control system that is a feed forward control system. So that is a kind of acid secretion in the stomach when the food is outside, which is not even inside your mouth. So that is mediated by vagus. Whenever the food is entering in your stomach, then that is causing stretch, that is releasing gastrin, again the acid secretion will be there. And when the food is even in the intestine, then also certain amount of acid secretion will happen. So please read this thing. Okay, right? Okay, visual and auditory transduction. So visual and auditory pathway is different, but here transduction means, you please read that in my lecture video, that how the visual transduction occurs, that in presence of light, what is happening inside the rod and cone cell. There is hyperpolarization in the rod and cone cell, and that is responsible for phototransduction. That concept is essential in the upcoming exam. And auditory transduction at the level of the hair cells. The bending of the hair causes release of neurotransmitter glutamate, which has already been asked in the previous year. But again, this kind of topic will be asked in future. Okay. And last May, again, the evergreen topic in physiology, non-REM and REM sleep, that I have already discussed briefly. But again, you have to revise all this topic along with the topic I have already shown. So the topics which I have shown already, that this is the core concept topic, that slide that I told you, that please take an image of this slide. Okay, so wo to hoga hi hoga, those topics are there, plus this expected topic or this upcoming topics. These are the main things in physiology that you should revise and concentrate. Okay, so this is my last slide. After this, I'm going to give you thank you for staying with me and listening me for the last 1.5 hours approximately. And now I'll give you a best of luck, and I'll encourage you that don't take tension, don't take stress, don't say again and again that I'm not remembering, I'm forgetting everything. Okay, and don't go for listening your motivation kind of video, that is wastage of time in my views. Okay, be faithful on you, trust yourself. Okay, that your brain, everything your brain is remembering, but it is in your subconscious mind. It is your confidence, it is your faith on your subconscious mind will bring you the answer in the MCQs. Okay, so custom module, I am remembering it in my subconscious brain. Okay, after 5 minutes I'll talk with my team regarding your custom module reminder. Thank you so much, okay, for listening. एंड ये आपका थोड़ा थोड़ा नाम चेंज कर लो यूट्यूब में, अजीब लगता है सब नाम लिखा, देखो BNSR, व्हाट शुड आई रीड इट, ऑक्जिम 11, ओ माय गॉड, IUCs, ओके, IUC K2Y। दिस टाइम INI-CET में मैकेनिकल रिसेप्टर से क्वेश्चन आया था, ओके, आ सकता है, देयर इज नो प्रॉब्लम इन दैट। ओके, तो थोड़ा सा नाम थोड़ा बहुत चेंज कर लो, नेक्स्ट जब सेशन लेंगे उसमें आसान हो जाएगा मेरे लिए। ओके, आई कैन सी ऑल योर नेम। ओके, थैंक यू। सो दिस इज ऑल फॉर टुडे, टेक केयर, बाय बाय, थैंक यू।